If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 10th season, and we are here to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. One is by calling the live phone line, you see the number below, and number two is by visiting our website at netny.net/askthedoctor. Here you can submit questions and opinions via the forum. Now for this episode, I have Dr. J. Herbert Balber, dental medicine physician and director of Jamaica Dental Center. Then I have Dr. Placido Morano, a rheumatology attending at New York Methodist Hospital. And next to him I have Dr. Emil Bakesh, geriatric medicine attending at New York Methodist Hospital and the medical director of Bishop McGovern Geriatric Center. Welcome to all. And I'm really excited about this show. I know I say that a lot, but I truly am excited here because we have, number one, a dentist, which we haven't had in a while. It's great, you know, I know a lot of dental questions out there. And then Dr. Morano always gets so many calls for rheumatology, and Dr. Bakesh, who always talks in the people's language. That's what I like. Whenever you talk,
thank you.
It's really a pleasure.
Thank you.
Thanks
My pleasure.
for coming. And I want to get right to the news so that we can get to our guests. First of all, the Tylenol recall. I don't know, many of you may have heard about this recall and think that it only involves Tylenol. But it's not just Tylenol. It involves Tylenol, Motrin, Benadryl, Rolaids, St. Joseph's aspirin, and Simply Sleep, a product to help sleep. And it's kind of disappointing the way the company, McNeil, handled this because they apparently knew about this defect about 20 months ago. And what it is a certain chemical that they use in transporting the drugs leaked into the drugs. And what it does is it makes people nauseous, vomiting, and stomach aches for a day. Now, luckily, nobody's died and you get better after, but people are getting sick, and it's unfortunate that it wasn't pulled from the shelves sooner. And it's unusual because the Tylenol makers had always been the example of the best communicators of these problems. I remember the Tylenol catastrophe with the cyanide, when somebody tried to lace it with cyanide. I think it was back in the 70s or 80s. The way they reacted was a model. The way they reacted this time was not that good. So what do? Well, before you take any medication, smell it. And if it smells like mildew, or musty odor, or just you don't like the way it smells, you can send that, don't take it for sure, and then you can call the company and send it back. So just remember to look on all the bottles of medicine for any of the products we mentioned, and then to smell it. Now the other thing is BPA. It's bisphosphonyl A is the name of it. But actually, it's a chemical that's used in many products that we use. For example, in plastics, in soda cans, in many things that we eat, in canned foods. And actually, if you looked in the urine of 93% of Americans, there's going to be this BPA. And the line on that from the Food and Drug Administration was, no problem, don't worry about it. Now, turns out that that advice was based on studies that the industry had done. And typically, when industry does studies, it may not be. It may be legitimate, but it may be biased, it may be slanted. And several other studies that were performed by independent people have demonstrated that it could harm people. And actually Canada's gone as far as to ban its use in baby formulas, and Chicago has banned it, the city of Chicago, Minnesota, the state. So what the FDA said, we're going to look at it again, but in the meantime, try not to use too much of it. So how do you try not to use too much? Well, number one, avoid using plastic containers for microwaving. Number two, limit your consumption from canned foods, okay? That's where you get the most amount. Avoid old scratch bottles. For infant formula, use powders or use glass containers. Don't use the plastic bottles. Look at the bottom of anything that you have a question of the plastics, and if it says PC, and then it's going to have recyclable number. Number 7, don't use it. But look for the recycling labels on the bottom. Number 1, number 2, and 4 are the ones that don't contain BPA. So when you turn the bottle over and you see where it says PC and then these recycling numbers, the bad one is number 7. And also look for stainless steel containers. This way you don't have to worry about it at all. Now, what can be said? I mean, the tragedy in Haiti is amazing. 200 to 300,000 people killed. It's hard to fathom. It's like, like 8 full house crowds at Yankee Stadium and all dying. So just try and put it in perspective, how many people. And the sad thing is that Haiti has had 15 disasters since 2001. And the time to act is not just to throw money in each time it happens, but try and prepare them so that it doesn't happen when the bad weather hits, when an earthquake hits, that the damage is minimized. Much has been done in Dominican Republic. When they had the houses all destroyed, they rebuilt them with proper building materials. Many of the buildings in Haiti are made of cardboard. So hopefully, I mean, we got to get this straightened out first, but then the governments of the world have to plan to try and help Haiti to avoid this the next time it happens, because it will happen again. Okay, now, the quiz this week is a very tricky quiz, I think. But I know that this audience will come up with the answer. So this is the quiz. If you looked in the Merriam-Webster dictionary, what English word has the most definitions? What English word has the most definitions? And I want to give you a hint because there are so many words. I know you guys are going through the dictionary now. It's a 3-letter word, okay? It's a 3-letter word, and it has 464 definitions, which is amazing, right? You talk about different meanings to what you say. You have to really have the dictionary when you tell me this. Be careful. So I want to mention Monsignor Bennett. He's sitting out there again. 10 seasons, the Monsignor. Now, Monsignor, I know you're moving to Kings Plaza area, I heard. You like it. There are good sales in that Kings Plaza. I remember when it first opened. And we'll get back. I don't know if Maddie's on the line or Joel is on the line, but we can get back to that. But we're going to take a short break now. Now, the key to this show is the phone number, 718-499-6101. You can talk about dental medicine, rheumatology, and geriatric medicine. So let us take a short break, pay some bills. When we come back, we're going to go right to the phones. This phone number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back, and you can't really, I don't know if you can see this, but the phone lines are already totally filled up. So we're going to do an abbreviated introduction of the doctors and then get right to the phone calls. I don't know if it's going to be Maddie on line 1, but tomorrow's her 89th birthday. We'll talk about that a little later. But you can often tell a lot about a person by the offspring, by the children. And I thought we'd talk about the children of these 3 doctors. Hi, Dr. Balber. It's good to see you again.
Good to see you.
And you're particularly proud of your son, Scott.
Yes.
Tell us a little bit about him.
Well, he was a top student in law school, and he's doing very well on the outside. And he has just been made the head litigator for his company, in charge of 200 other litigators, worldwide company.
Excellent. And this is, I know he's had a big settlements lately. So
and he's had a big settlement lately, won a $24 million case.
Does he send the father a little vacation?
I wish he would, but he's very tight these days.
Scott, help him out. Help out the old man.
Yeah,
okay.
give me a break.
All right. Now, and Dr. Balba is going to be talking about all your dental problems. Now, Dr. Morano is no stranger to us, but let's talk about your daughter, Jackie.
Yeah,
Dr. Jackie.
Yeah,
Tell us a little bit about her.
she's in Chicago in medical school, and she loves it. She loves medicine, and she's probably going to go into sports medicine.
Oh, sports medicine.
Yeah,
wow.
because she's an athlete, and she loves to talk about dieting and health and exercising.
Will she come home, you think, at the end?
She might stay in Chicago.
Really? It's a nice city.
Which
It's
is
a nice
a good thing and a bad thing for us, but we love her.
That's great. There's 2 successful. Now, Dr. Backish, not only is going to talk about his son, but brought his son. I wish you could see him, a cute kid.
Yeah,
Peter?
Great kid. Peter, yeah,
How old
he's
is
a great
Peter?
guy. Peter's 9. He's
Tell
9
about
years
some
old.
of his talents.
Peter's a great soccer player, unbelievable soccer player. He plays for a traveling team, and he's very agile, amazing. Great student also.
I think he's in the control booth.
He's,
so
he's,
we
he's
may
actually
have a
running
good
the show,
production.
actually.
Yeah, we could have a...
Yeah.
No, I like the control booth. It's always good. I'm just joking.
He's a great kid.
But it's great to see him. He's at PS 321?
321, yeah, on 7th Avenue in Park Slope.
Who's the principal there?
Ms. Phillips.
So he doesn't have to do his homework tonight.
I guess not. No homework.
But anyway, it's a pleasure to have everyone here, and I know the suspense is mounting for who's going to be the first caller. So let's see who's on line 1. Hello?
Hello?
Yes, hi, who is this, please?
This is Larry from Rockland
Oh,
County.
Larry, you called. I haven't heard from you this season.
Well, we had difficulty getting through, and it's one of those situations where this morning I started dialing your number now, and in the hope that I would be able to get on to the program.
Now you caused a little controversy because it's Maddie's 89th birthday. The woman thrives on being the first caller. But
oh, congratulations, and I feel terrible.
No, but tell us what you. Hey, you have a question for the dentist?
Yes.
Beautiful. Let's hear what you got.
Doctor, I have a problem with my gums. I had been to a dentist, and he gave me a bottle of Perry something or other. I don't know what it was, but he told me to rinse my mouth with it, and it relieved some of the tenderness and the bleeding in my gums. But however, it shows up again in another area, and I use a water pick. I try to brush my gums to stimulate my gums. Sometimes they have a little blood on it.
I think we get the picture. We get the picture. Thank you. You know, the people are still eating.
Now, is that gum disease, or am I doing something wrong?
What do you think?
Well, you're definitely not doing anything wrong. It seems that your dentist has prescribed Peridex for you, which is an oral rinse, and it's effective. But if you have advanced periodontal disease, then the best thing to do would be to see a specialist and get an evaluation, because there are many ways to treat it. It's unfortunate that we get periodontal disease as we get older, because the human body was not designed to have teeth longer than 35, 40 years, and it's only through advanced medicine that we are able to keep our teeth and to be able to live longer.
So it sounds like it can be helped.
Yes, it certainly can.
So that's good news.
There are many ways to do it. Modern dentistry today can even grow bone.
Can I interject? There's also a problem between periodontal disease and cardiac disease.
Yes, there is a connection between the two. And, you know, the same blood that goes through your gums and your teeth goes through your heart. So it can lead to complications there.
Okay.
I hope that helps, Larry. And I know one of the most loyal listeners calls from Rockland County. What does it cost to call here from Rockland County?
He
doesn't even care about the cost. See, that's what I'm talking about.
Whatever it is, it's cheap when I can get to talk with the doctors.
Thank you very much. Call us back soon, okay?
What was that question about the
heart disease?
No, about you had a quiz or something?
Yes. What English word has the most number of definitions if you would open up the dictionary? Three-letter word.
I think the word is the, but I'm...
Can you please repeat that?
The.
No.
Okay.
Not close.
Okie doke.
But thank you for that.
Okie doke.
Okay, thank you. Take care. Have a nice day.
You too.
Bill? Who we got? Grace? Who was that? Grace?
Yes, it's me, Grace.
Grace, how are you? Grace, turn down the TV.
Yeah, I put it on mute. Is that all right?
That's good. Where are you calling us from?
I'm calling from East Flatbush.
Oh, very nice. Near Tilden High School?
Excuse me? I'm trying. All I can think of is just right off the... I'm not sure. Etc.
Okay. Etc. Okay. What can we do for you, Grace?
Yeah, it's about my legs, my knees, and my ankles. I was diagnosed about 6 years ago, osteoarthritis. I'm 75 years old, and I went to an orthopedic surgeon. I had x-rays taken. That's what
Okay, let me ask Dr. Morano what can be done, and number one, what is
I'm suffering with excruciating pains in my knees and ankles.
Okay. Grace?
I can hardly climb the stairs.
Grace, I want you to listen to the answer now, okay? I'm going to ask Dr. Morano to talk about what is osteoarthritis, and then what can Grace do?
Grace, osteoarthritis, when they tell you have osteoarthritis, they probably did the x-ray, and they show that your joint space is narrowed. And you know radiology better than I, that when the joint space is narrowed, that means the cartilage that is between the two bones is diminished.
Right.
And so what happens is you have increased pressures on the bone and the surrounding tissue, and that leads to pain. So you probably can't walk as far as you used to.
No, I'm on a recliner practically all day long.
Oh, that's horrible. When you get to this level, you might have gone through multiple medications, and one of them we use is Tylenol.
I was given know, because I had sciatica too.
Oh, boy.
But the Flexerol cured the sciatica, but it's just the doggone thing. When I go to sleep at night, I'm up most of the night. My
He's in
legs.
pain. So, Grace, listen to me. One of the best types of therapy for you was probably aquatherapy in water. She'll be weightless in there. And you need medication as far as pain is concerned. Therapy, pain.
That is not good enough.
Yeah, you know what? I think it is because Grace.
Yes.
Because I don't want to rush it, but we have so many calls. I think Dr. Morano is saying you need some kind of physical therapy, which would include water therapy. So when you go to your doctor next time, ask him for this physical therapy, which will exercise and make you feel better. And then
I did go to one-on-one therapy for 40 times, but it didn't help.
Yeah. Did you go in the water?
No, they didn't have anything with water
All right.
there.
So I think what you could do is you could contact
Water therapy, as well as injections in the joints can be done, and you need pain management of this, as well as losing weight.
We're so happy to hear from you, Grace, and hope that you take this advice and feel better. You have Dr. Morano's number if you want to see him as a patient. Okay?
Yeah, I never heard of him. I went to Dr. Urban.
No, he's very good.
Irving? I don't know Irving. If you knew Irving. Anyway, bye-bye.
Grace will make you laugh, too.
Good luck,
okay?
Grace.
And listen, we eat at the Floridian or the Arch Diner.
Oh, that's your favorite? What about Kings Plaza Diner?
Oh, and the Floridian.
Floridian, nice place.
I'm across the street from the Kings Plaza Diner.
Great
near
place.
you.
Okay.
Okay, thanks a lot, Grace.
Thank you.
Hi, who's got Bill now?
Yes, hello, doctor.
Bill, how are you doing?
All right, doctor.
Where are you calling us from?
Astoria.
Which place? I'm sorry?
Astoria.
Oh, Astoria. I was actually there Saturday night.
Where were you at?
I was at Piccolo, very crowded. Piccolo
Oh, that's
Venezia.
good. I eat home because your home cooking is better.
I agree. Do you cook or your wife?
Excuse me?
Are you the cook?
No, my wife's a cook. I'm the
Very-
dishwasher.
Oh, are you calling with the answer to the quiz?
No, I don't know it.
No.
I'm
Okay.
I called up 2 weeks ago, and I forgot to ask you some questions. I told you I had a heart attack
I remember.
and a stroke, and I wanted to ask you. I lost like 30 pounds, and I can't seem to get it back. I'm down to 117 pounds, and my hands are always cold all the time.
Let me just ask Dr. Backish to address that. He had a very bad stroke, heart attack, terrible. Just was brought back from the dead, right?
Right, you remember.
I remember. And he's lost weight now. How does he put that back on?
Sure. Well, having had a stroke and having had such a major change in your lifestyle, I'm sure has had an effect on you. You're probably not doing the normal routines that you usually do. So if a lot of it's probably a combination of things. One is you're supposed to lose weight and take care of yourself after a stroke and a heart attack by eating a low-fat diet. You were probably prescribed a low-fat and low-salt diet, and of course that may not taste as good to you, and I'm sure you may be eating a little less as a result of that. But the way to gain the weight is it's all about how many calories. It's good to be thin. I mean, so I don't know how tall you are. If you're 118 pounds, and you know that's about the right weight for somebody who's 5'3", 5'4". How tall are you?
5'5".
5'5", so you should weigh, it's for a man, it's if you're 5 foot 106, add 6 pounds for every inch. So 5'5" is 130, should be around 140. You're about 15, 20 pounds under. So you gain weight by eating carbohydrates, basically. So if you eat pasta, rice, potatoes, bread, and you know, then you'll gain weight. You have to avoid fatty foods. And but I wouldn't be so upset. It's good to be thin, as long as you're active. You want to lose total body fat, but you don't want to lose lean body mass. So in other words, you don't want to lose your muscle, you just want to lose the fat. And the only way you keep your muscles is by exercising and having a balanced diet. So I wouldn't be overly concerned as long as you're feeling well.
What about those shakes? Do they help at all? Those shakes to gain, Ensure and that stuff?
Ensure is a balanced diet. It has no dairy in it. You could do that. There's about, and depending on which product it is, Ensure Plus has 250 to 350 calories in each container. If you had one of those a day to supplement your regular food, that is a good idea. I wouldn't use it in place of your regular food, but if you just had one a day, that might be enough for you
Bill,
to gain
thanks a
some
lot.
weight.
Hope to run into you up in Astoria one time.
Yeah. Thanks
Okay?
a lot. Tell Maddie happy birthday.
Thanks a lot. Take care, Bill. Thank
Bye.
you. We're now going to go to Jane. Hi, Jane. Jane?
Hello?
Hi, Jane. How are you?
This isn't Jane.
What name is that?
My name is Rosemary.
Oh, it's easily confused. Yes.
Sounds exactly the same to me.
Rosemary.
It's me. How are you?
I haven't heard from you in a while.
I know.
Oh.
I didn't get. I mean, I just went straight through to you. I didn't even talk to anybody.
Really? This is. I knew they could put a little thing, Rosemary.
My God.
We like to get you back on.
Right.
So, any new places to talk about to eat?
I have an answer.
No.
Yes.
Can you just wait for the drum roll? Hang on.
All right.
Now watch how well coordinated.
I don't know if this is right.
Drum roll, please.
It's probably not right.
What is it?
Set.
Rosemary.
What?
You have absolutely correct. 100. Listen to Pandemonium at the home. How did you get it?
I was talking to my daughter, and I don't know, set, she said.
Set is absolutely right.
Oh, good.
This is amazing that you got it so quickly.
But isn't it amazing that I got straight through?
Well, it was meant to be, they say, right?
Divine intervention. What can I tell you? I've been trying to win this thing.
Wait till you get. It's going to be speeding its way as Linda Lapatosa, our plasma master, is busy working on this.
That's where I am.
Okay, you see on the back, handmade in Japan. This is not cheap stuff.
I don't mind. I want it.
I can't believe it either.
I can't believe it either.
So.
And you know, my father's favorite restaurant was Piccolo's.
Oh, I love that place.
Yeah,
actually.
he loved it too. He's since passed, but that was his favorite, one of his favorite places.
If you ever go in there, ask to look at the little Ask the Doctor plaque on the wall.
Yeah, yes.
You'll see that up there.
Oh, well, we'll have to look.
So tell me, what can we do? I know you're all excited.
Well, now I'll ask a question also. Well, I wanted to ask about Alzheimer's.
Okay.
Okay. Now, what would be some of the key things to look for? Somebody was telling me about smelling strawberries, that you don't get the scent of strawberries. I don't know if
Interesting. There was a study about that. I asked Dr. Baggers, but about loss of smell.
Right.
Did you read that study?
No, I don't think I did. But loss of smell could be one of the signs or symptoms. So there's several others. Usually the patients have loss of short-term memory. They forget recent events, and they can't recall things that just transpired, even if it was just a few minutes ago.
Okay.
And then they develop disorganization, and sometimes they lose ability to handle their finances. I just had a case today where a patient actually was subject to a scam artist and wrote a check for $60,000, and now the family's having difficulty. But it's very, you lose the ability to control your memory and everything that has to do. As it gets more advanced, what happens is you lose the ability to speak. So it's a disease of speech. You get aphasic, where you lose, your words are not able to come out the way you want them to come out.
Right, right.
And then you become apraxic, so you can't do practical things that you normally could do. And it goes on to even things like walking and talking and swallowing.
Right.
And also then you get agnosia. You can't recognize people or things or objects. So it gets to the point where you become immobile and you can't swallow and you have to be fed by artificial means. But it's a gradual process that takes a very long time.
Yeah.
But it's interesting, the smell.
Smell
there's
could be
10
a
items.
prodrome.
10 items that people with Alzheimer's have difficulty recognizing.
Right. I know one was strawberries.
Yes.
It's very
Now,
common.
is there anything, what could you do to, stimulate the brain, work on different things you haven't done before?
Well, I think, if you engage yourself in conversation, listen to the radio, try to do crossword puzzles, or, work as long as you can.
Exactly.
You can probably delay it and, try to limit your intake of alcohol and things like that.
Right.
There's really no drug that
can
prevents
stop.
it. There are some drugs on the market that slow down the process. Like Aricept and Namenda and these types of drugs, but they're by no means miracle drugs. They sometimes don't do anything, and they can have side effects.
Rosemary, thanks so much for the call.
Thank you
Congratulations on the win.
I'm so happy. But how will they know where to send it to me?
You're going to stay in the air, and then you're going to give your number.
Okay.
And we send it out freight, so you probably get it next week.
Oh, great.
Okay, good.
Thanks
a lot.
We'll
Take
see you.
care.
Bye.
Hi, Liz. Liz? I think Liz is.
Yes.
Hi, Liz.
Yes.
How are you?
Hello.
Hi, Liz. Is your TV on?
My TV is off.
Oh, good. Where are you calling us from?
Staten Island.
Staten Island. Very nice out there. Which part?
In Mariners Harbor.
And what do you like to eat out there? Give us a hint.
What do we like to eat?
Which restaurant's your favorite one?
Oh, Perkins.
Perkins. What kind of food is that?
It's Italian. It's anything that you like, really. Italian.
It's like
A little bit of
Italian.
everything.
Italian. You ever hear of Italianissimo?
No.
Very nice. Have you heard of that place, Dr. Balber?
Perkins I have.
Perkins.
I've been
Dr.
there.
Balber likes Perkins.
Yes, it's very good. A very big selection.
Yes, and the
And
Coca
reasonably priced.
Yes.
So, Liz, what can we do for you?
Okay, this is a question for the rheumatologist.
Okay, Dr. Morano?
Yes. I'd like to know if acupuncture is a treatment recommended for arthritis.
Interesting
Interesting
yeah.
question.
Yes.
I'm not an acupuncturist, but I do refer people to acupuncture, especially with chronic pain, especially people who can't take some of my medications. Remember, some of my medications are very toxic. They could give you GI bleeds. So I do recommend acupuncture, especially for the people who can't take medications. Does it cure osteoarthritis? No, it does not. Does it help with pain of osteoarthritis? Yes, it does. And it will vary from person to person. But so, yes, I do recommend acupuncture.
Interesting. Very nice. How does
It has its
she find one?
place.
How does she find a legitimate guy?
You go into A.
Did you hear this?
AC, I believe.
You can call my office, and we have a list of acupuncturists that we refer to.
Oh, great. Thank you very much.
Good luck, ma'am.
Give us a follow-up.
I will.
Thank you.
Thank
Let's go now to Ellen. Hi, Ellen.
Oh, it's Eleni.
Eleni, nice name. What is that Italian?
Actually, it's Greek Orthodox.
Greek Orthodox, beautiful name. What does it mean?
Bright one.
Bright one. Very nice. It's a great name.
It's okay.
This is the first time you've called us.
Yes.
Yeah. And how is everything?
Okay.
Did you-
I've been out of the nursing home for 3 months.
Okay.
Before that, I was in a hospital, and
How old are you, Eleni?
I'm 49.
Wow. So you were in a nursing home. Prior to that, a hospital.
I was in the hospital 3 months,
Wow.
nursing home 5 months, and now I'm home.
And what put you in
And
the
I live
hospital?
on Westminster Road, right down the road from the distinguished doctor.
Oh, that's nice. Let me ask you, what was wrong? What put you in the hospital?
They said that I caught something from the dog,
Wow.
some kind of bacterial infection.
And that put you in the hospital for 3 months?
And I wound up having a stroke.
Wow. Well, I want to talk about, it's not impossible, as you sadly show us, that a young person can have a stroke.
Sure.
And it could be a number of warning signs and maybe no warning sign. Dr. Bakish, what are some of the things that might tip off that somebody would be at risk for a stroke, 49 years old?
Well, yeah, young women actually have strokes. It's not that uncommon at all. Younger women, especially who are on birth control pills and smoke, are very...
No, I don't smoke.
Right, well, that's great.
I'm not on birth control.
Right. Young women also can get strokes if they have some other secondary illness, if they have hypertension or if they have diabetes. But even if you don't have any of those and you're healthy...
No, I have pernicious anemia.
Pernicious anemia.
Pernicious anemia. Pernicious anemia is due to a B12 deficiency, a vitamin deficiency.
Yes.
But that in and of itself is usually not associated with stroke. But strokes can just occur, and all you need is a very small clot that can cause devastating effects in the brain. Unfortunately, I have had young patients who've had strokes that are females that have had strokes. But it sounds like you were able to recover and get through the hospital and get through the nursing home, and now you're home, and that's wonderful. Your speech, as I can hear it, sounds pretty...
It's not slurred.
No.
It's not slurred. It's very clear.
And I'm walking without a walker now.
And so you made a great recovery. I think this is a wonderful thing. I think you just got to keep it up and be positive about it. Sometimes after such a long confinement in hospitals and nursing homes, you can have what's called a post-confinement or post-hospital depression. You just have to, get through that and get back to your life.
Okay,
and
question.
Then, yes.
Anything dietary?
Dietary? Well, basically being on a low-fat diet, a low-salt diet, making sure your blood pressure is okay, blood sugar is monitored okay, staying physically active. You shouldn't overeat. Overeating, if you lost a lot of weight, overeating is not a good thing because you can't catch up. Just eat a normal amount of calories. Balanced low-fat diet. Fat is the key. just trying to eat as little fat as possible. So no more than 30% of your calories is fat.
Eleni, I hope I'm going to see you in Prospect Park, okay? You come over and say hello.
I see you when I walk my dog.
Really?
Yeah. You're the house.
Did you by any chance not pick
You're
up
on the
dog
right-hand
yesterday?
side.
I tell you, I walked out, I stepped right in. That wasn't
And
you.
you can't miss me. I used to have a Staffordshire Terrier. Now
Wow, I think I remember very well.
And my Uncle Irving, the Udalowitzes, live around the corner.
Wow, yes, it's all in the neighborhood. So I hope to see you around the neighborhood soon, okay? And thanks for the call.
Thank you.
Take care. Nice call, huh? Vanessa?
Yes, hello?
Hi, Vanessa. How are you doing?
Doing good.
Where are you calling us from? Vanessa? See people, you can leave the television on?
Okay, yes, it's on.
Turn it off, turn it off.
Yes.
Okay, so where are you calling us from?
Staten Island.
Oh, nice, we have a second caller already tonight. What do you like? We heard about Perkins. Do you know that place?
Yes, I have.
Is that any good?
It's nice, I like it.
You like it? Okay, I'm going to have to try it. What can we do for you?
Yes, I have a missing tooth, and I just wanted to see if I can get an implant there.
Oh,
and
missing
I just wanted
tooth.
To get, yeah, I just wanted to know all information that I can possibly get for that.
How'd you lose that tooth?
Actually, I had to have a root canal done on it, but I decided just to take it out.
I see. Okay, let's ask Dr. Balber. What do you think?
Well, it's the up-and-coming call for dentistry these days, and it's really the most important thing, I think, that has developed in the past 20 years with dentistry, which is dentistry itself is progressing like leaps and bounds. Implant is a very good method for replacing a lost tooth because it's basically very simple, and it's not any kind of pain involved, and that you find that you have a tooth after the implant is in. You have a tooth that you don't have to worry about. Just take care of it, keep it clean. It'll never decay, and it'll be
so
there.
You recommend that?
Oh yes, it'll be there, forever, really.
You know, I got to ask, is that you would recommend that over a root canal and a cap?
Well, it depends, where in the mouth it is and what the condition of the bone is as to whether you would do a root canal and a cap. But, all in all, if you have good sound bone, or even if you don't, because they can add bone, you can achieve tremendous results with implants. So we're running a special this month and next month on at my clinic on implants.
Okay.
And it's really the most effective way to replace a missing tooth.
So you have Dr. Balber's number if you need to talk to him. And thanks for the call. We're going to take a break now. We're going to pay some bills, pay attention to our sponsors, and we'll be back shortly. So when we come back, the number's still going to be 718-499-6101, where we can talk about dental medicine, rheumatology, and geriatric. So once again, we're going to take a short break. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to this lively show. A lot of calls, a lot of interest in dental medicine, rheumatology, and geriatrics. Dr. Balber, tell me that drilling sound. I can't take it when I go in there. How do you do that all day?
Well, we don't really hear it that much. We're used to it because we've been doing it for so long. But the new high-speed drills that we use are really very effective, and a lot of them do not have that much sound at all.
So how do you calm down the patient? She hears the drill, goes in there. What do you do?
I talk to them, mostly. And
tell any jokes? Or no?
Yeah, we tell jokes. We try to distract them.
That's good. But it's changed, right? Dentistry has been a big change.
A big change. There's so many developments in dentistry. It's really incredible.
Hope we get some more questions about that. And we're going to go to Jane, who unfortunately was bumped before, but we got her back now. Jane.
Yes.
I thought we lost you.
Yeah, I know. I got disconnected somehow.
Where are you calling us from?
Middle Village.
Oh, Middle Village. And what's out there? What's the #1 restaurant in Middle Village?
The Woodhaven House.
Oh, Woodhaven. Is that near London Lenny's?
Right next, on the next block. It used to be Kate Cassidy's.
Oh, Kate Cassidy's. The nurses from St. John's used to go there, I know, after their shift. Yeah,
now it's called the Woodhaven House.
Wow. And London Lenny's is having, I heard, like the 65th birthday celebration.
I go there all the time.
Nice place.
I go there all the time. London Lenny's.
So what can we do for you tonight?
I got the lobster spit.
The reason I'm calling is I have a swollen abdomen. I've had it for since October 2007.
Okay.
I've had numerous tests, endoscopies, colonoscopies, blood tests, CAT scans. Nobody can find out what the problem is, okay? And I have, like right now, I have very severe constipation.
Jane, can I ask you a question? Is this something called fluid, or they couldn't find any fluid?
No, there is no fluid.
So it just bloated?
Right.
Okay.
But I'm very constipated.
Any of the doctors have any thoughts on this bloating going on for 2 years? CAT scans are negative.
Sure.
She's uncomfortable.
Sure. Some patients, as they get older, they get uncoiling of their large intestine. If you think of the large intestine as an accordion, and as you get older, the accordion just stretches out and gets more flaccid and weaker. So the rings that generate peristalsis, or the movement of the stool around the colon, becomes less effective because the rings are further apart from each other, and you get what's called a redundancy of the colon. And that, along with some weight gain and decrease in the abdominal wall muscles, and you get a poor tone of the abdominal wall muscles, and the end result is what looks like a large abdomen, which is a combination of things, which is a little weight gain, a little increase in abdominal wall fat, flaccidity of the abdominal wall muscles, the rectus abdominis, and then also increase weakness of the whole intestines. And I would say that's a very strong possibility if the workup was negative. The workup is certainly justified.
I've lost 60 pounds, and the bloating has gotten bigger.
Oh, you lost 60 pounds? Well, the other possibility, sometimes in patients with liver disease get swollen abdomens, but they would have certainly figured that out by now if they've done a lot of tests.
Jane, are you taking any medications?
Yes.
What are you taking?
I take Zocor for cholesterol.
Right.
I take lisinopril for high blood pressure.
Right.
And I take Lumexis for diabetes.
But my diabetes. Well, that's interesting. I mean, diabetics can get what's called NASH, N-A-S-H, which is a non-alcoholic steatotic hepatitis, which is a form of liver disease, which is caused.
They checked all that. They said my liver function is fine.
It
no
was
problem.
fine, and they didn't find any abdominal fluid in your abdomen.
No, but I had before, like years ago, I had Hashimoto's thyroid.
Well, that's certain. That's something that needs to be checked if it hasn't been checked.
But this is the problem. I have all the symptoms of thyroid. I'm always cold all the time.
Right.
My nails don't grow. My skin is very dry.
Right. Well, did they check your thyroid function? It's a simple blood test.
Every time they check it, it's fine. But when they do the scan, they said I have an enlarged thyroid.
Okay. So you have.
And my weight fluctuates. One day I'm 4 pounds more. Next day I'm 4 pounds less.
Sounds like there's something either related to hormones or to medical. Less likely to be dangerous.
But I have very severe constipation.
Yeah, well, that can be treated with a drug called Miralax. You could take that every day.
I tried that; it doesn't work.
A glass of warm water on an empty stomach the first thing in the morning, and increasing your intake of.
I've tried everything. The doctor even gave me something called Crystallose.
Crystallose, sure. Walking a lot, exercise.
That worked for a while, and then it stopped working.
Jane, we gotta, maybe a good time for second opinion. Somebody to take a fresh look at the test and see where to go from there. So I hope you're going to do that, because it sounds to me like we haven't gotten to what the root of this is, and it's bothering you. You're losing weight, and things aren't right. So you can call us up for a referral. You want to talk to any of the doctors on the panel? That's fine. But why don't we talk later? Okay.
Have a good night.
You too. Be well.
Good night.
Hi, Pat.
Yes.
Pat, how are you?
Yes.
Can you speak up a little bit?
Yes, I can.
Where are you calling us from? Checking.
Dr. Gardner, it's Pat from Park Slope.
From Park Slope?
Yeah.
Okay.
Remember I used to call you all the time?
Oh, you had a cousin who was quadriplegic?
Right. He got paralyzed in
How is he doing?
Accident.
Pat, you better turn the TV off.
I have to turn it's off.
Because I hear something in the background. No?
Yeah.
How have you been?
He's doing okay. He's actually driving. He's going to get married.
Beautiful.
And, hopefully someday something will happen with the stem cells,
I know you had a number of problems. You were having some psychological difficulties.
Yeah, you know what it is, Doc? I went for all the tests and I was okay. But my stomach is like, the acid in my stomach is so bad that I can't even, I'm constantly going to the bathroom and it's all heat going up and down my spine. And it's just terrible. And it's like, I get like lightheaded all the time.
Yeah. Let's tie, I just want to tell the panel, his stomach, when he gets anxious and aggravated, his stomach becomes acidic, a lot of pain and so on. And I don't know if any of you two have. We've been talking about this for a couple of years now.
Well, you can have, if you're an anxious individual, you may have spasticity of your stomach and hyperacidity, which is very common. I mean, there are plenty of ways of handling that. There are drugs, but I think lifestyle changes, and if you're very anxious, you can even see a therapist, and he can talk to you, find out coping mechanisms, find out ways to make you stronger so that you're not affected by this. There's medications as well that can calm down your stomach as well as help you relax and help you enjoy life.
Right. They've given. What is the lightheaded and dizziness all the time from that, Doc?
Well, when you're anxious, if you're anxious and you get lightheaded, if you hyperventilate, you're blowing off carbon dioxide, which can change the acidity in your blood. It can change the pH of your blood, and that will make you lightheaded. So It's probably a metabolic effect of your anxiety.
But Pat, I'm really glad to hear from you. I was worried. We didn't hear almost a year and a half, I think.
You know what it is, Doc? Exactly a year and a half. I just got the cable and the new cable in.
Oh, good. So hope to see you around, okay?
Definitely, Doc.
Call
Thank
us
you very
back.
much.
Take care. Let's go to Margaret. Hi, Margaret. Margaret?
Hello.
How are you?
I'm okay, thank you. I wanted to say thank you for the comments you made about Haiti, the moderator, because I'm from there. And I wanted to thank Dr. Moreno because I saw him about a week ago and last month at the New York Methodist Hospital at the clinic. My question is that I suffer from arthritis, and I always assume that arthritis, someone who has arthritis also may suffer from rheumatism. In fact, even in French, I think our word for arthritis is rheumatisme, which means rheumatism.
Yes.
So my question is, does it follow that if a person has arthritis, does it follow that you have rheumatology? And I'll close the phone and hear your answer on the TV. Thank you.
Thanks a lot, Margaret. Thank you. So what's the deal? Rheumatism?
Rheumatism is a generalized term. Rheumatoid arthritis is a specific disease, and it's not osteoarthritis. Some people confuse osteoarthritis with rheumatoid arthritis or osteoarthritis with osteoporosis. Different animal. Osteoarthritis, again, refers to the destruction of cartilage and increased pressures between the bones. And that can be seen in the spine, the knee, hand, a number of joints. Rheumatoid arthritis is a systemic inflammatory condition that the joints are sort of secondary bystanders. They get affected by this inflammation. And rheumatism is a generalized term. And people get confused by these terms. So whenever you go to a doctor and you say you have rheumatism, what is it? Is it rheumatoid arthritis? Is it lupus? Is it osteoarthritis? So you have to try to be specific when you use these terms. And we don't use rheumatism as a diagnosis any longer.
I wanted to ask Dr. Balbert because there's a joint in the jaw where the jaw articulates, and that can sometimes cause pain, right? The temporomandibular.
Temporomandibular joint pain is predominant in a lot of people, and there is effective treatment of it, but it depends on each case. But it can cause a lot of problems, including trigeminal neuralgia, which can really be very, very painful.
So that can be anywhere, the rheuma, and usually both sides.
Rheumatoid arthritis can be affected, the TMJ, neck, multiple joints.
All right. Thanks a lot, Margaret, for the call. We appreciate that. Let's go to Tony now. Hi, Tony.
How you doing?
Tony, where are you calling us from?
Okay, I'm calling from Mill Basin.
Oh, I was just out there, actually, on beautiful area. Are you off the water?
No, I'm close to Kings Highway in East 46th Street.
Okay, very nice. There's some really nice restaurants out there, huh?
Yeah.
Actually, the Floridian Diner's not far.
Yeah, it's close by.
Who was talking? A woman was telling us about that. You like that place?
Yeah, it's pretty good.
It's pretty good.
Good.
What can we do for you?
Okay, now I had an injury at work with my spine, and I pulled some disc. This was sometime in '05, and now I had a procedure done. I had epidural done. I had spinal tap and decompression of the spine. And since November of '07, I've been having a constant fever on and off, and I've been going through PET scan, CAT scan, nuclear testing, X-rays, everything, and they cannot find the blood tests, everything. They can't find why I keep on catching this fever on and off.
How old are you?
I'm 43.
Wow, young guy. What do you think about that, Dr. Moreno?
And this happened after you had these procedures. Is that correct?
Yes, it happened right after my last procedure, which I think was spinal tap or decompression of the spine. It happened like a week and a half right after that.
Well,
on '07.
I mean, cause and effect. It's hard to know what's going on, but you have to worry about iatrogenic-induced infections. And what I'm trying to say is a procedure that introduced an infection inside your body. Now, I'm not saying that's what you have, but that's a suspicion that I have. And sometimes you could get abscess formations, and they're very hard to detect, and they could give you fever. There are other diseases that can give you fever, like tuberculosis, but the workup is extensive. Some people have a fever of unknown origin, they call it FUO, fever of unknown origin, and you have to do extensive workup, and that includes hepatitis workup, lupus workup, et cetera, et cetera. And this is hard to find sometimes, but it's suspicious to me in your case that they did a procedure and then you had a fever. So you have to look for things like abscess. And I don't know if they did a gallium scan on you, and you probably be able to, indium scan might be an indication.
Even with a CAT scan in contrast, we might be able to see this. So it sounds, again, second opinion. We talk about it all the time. You know, the original person that did it may be locked into a diagnosis, may not see everything.
Second opinions.
So a second opinion, you want to call any of us to help, or we can suggest somebody that might be helpful to you. Give us a call after the show.
Good luck, really.
Tony,
definitely. Thank you.
Tony, good to hear from you.
Thank you so much.
Let's go to Dorothy now. Hi, Dorothy.
Hi.
You calling? I know you're on Midwood, in Flatbush area, Midwood Street.
Yes.
We haven't heard from you for a while.
Oh, this is the first time caller.
That's
no. We had another Dorothy from the same neighborhood. Wow. It's a small world.
Maybe I'm popular.
Where are you calling us from?
I'm calling from Brighton.
From Brighton
and
Beach.
Coney Island.
You like to walk on the boardwalk?
I'm handicapped. I cannot walk on the boardwalk, and I'm homebound.
No, you don't get out at all?
No, I cannot. I have the wheelchair and a walker.
Can't even get away from the show.
Well, but I listen to the show all the time.
Thanks. What can we do for you?
Well, I like to know what to do about carpal tunnel punishment. Carpal tunnel, and it's very, very bad. And the fingers are numb in the beginning, the tips and all the tips.
Okay, and so how old are you?
91.
Wow.
Young.
Congratulations. Congratulations. You actually got Maddie beat.
And I share my age in half because I'm a twin.
And the other wow. Amazing. So you stunned me here. What can we do about this carpal tunnel?
Carpal tunnel is the nerve that goes into the first, second, third, and half of the fourth finger. And sometimes it gets blocked at the wrist. And that's what carpal tunnel is. You get this tingling sensation, burning sensation, and the muscles here could atrophy. And that means it gets weaker. And you could be dropping things.
That's what happens to me. I keep on dropping things.
If this is very bad, you need surgery, basically.
I'm too young for surgery already.
Well, there's guys that do. They're very good at doing this.
I had too many surgeries. I have orthopedic hip replacement and hip revision.
If you don't want surgery, the only other options you have is using a splint. And what I recommend to some people is vitamin B6, 50 milligrams a day. It's been
B6,
shown in some cases.
Any brand?
I'm not a brand person. I'm generic.
B6 only?
But anyway,
I take a lot of vitamins. I eat health foods, and I do my own foods. I eat healthy foods at home.
The only thing, if you don't want to have surgery, is a splint on your wrist, especially at night, and vitamin B6. And sometimes we can inject this if you want to come in.
Where do I get the injections?
Right in the wrist.
No, I mean, where do I go?
You can go to Dr. Morano's office.
I'll do it if you need.
Would you like that? You can get the Accessoride to bring you over, an ambulette.
The thing is, I don't have Accessoride right now. It just finished.
I don't do house calls anymore.
What about an ambulette?
Almost got hurt.
Well, can I get in touch with the doctor? Can you give me the phone number?
Well, yeah, see the phone number flashing up there. And just remember, remind them who you are, okay?
Good luck to you, hon.
Which doctor is this?
You can, Dr. Morano.
Morano. I'm Dr. Morano.
Okay?
I'd like to try with the injections.
We're going to try it.
Is that cortisone or what kind?
Correct.
That's what it is?
Yeah, to decrease the inflammation around the nerve. Sometimes we do that.
I wear the splint at night, but it doesn't help you. The thing is, I think it's from my professional work that I did a lot of typing years back.
That's what it is.
That'll do it. Dorothy, we got to run, but
all right, thank you very much, and wish you all good health and a happy new year.
Call back soon.
And keep young and smiling.
Yes, thanks. Beautiful call. Teresa?
Yes?
Hi, Teresa. I'm sorry to keep you so long. How are you?
I'm fine, thank you.
Where are you calling us from?
From Flatbush Avenue.
I hear a slight accent in there. What is that?
I'm Hispanic.
Beautiful. From which part?
Panama, Republic of Panama.
I was in Panama City last year. What a beautiful city.
Thank you very much.
Great restaurants, just magnificent.
Yes.
It rained a lot, though, a little rainy.
Yeah, well, we are in rainy season.
Yeah, but great place. What can we do for you?
Well, I have a problem. I've been a nurse for 27 years, and I started having some problems with my abdominal wall. And I've had so far 10 ventral hernia repairs.
Wow.
The doctor says that my abdominal wall is weak, and it would tear in the slightest. I just had surgery March 23rd.
You can. I think this again. I hear a lot of surgeries. Second opinion. You call Dr. Stevens. He was on our show. Have you watched a couple of weeks ago? You can get his phone number from the website. And I would call and get another opinion because it's going to keep going on. It sounds like.
Yeah, they just keep cutting me and surgeries and surgeries. And he told me that he used all the mesh. He says he don't know what other mesh to.
I want you to call the Dr. Stanley Stevens, who was on this show, and he's going to listen to you and see what you can do. Okay.
Okay.
Make an appointment. Very important.
Can you give me his number? Because right now I'm already seeing the rising on the side of my stomach again. I'm going through the nausea, the vomiting, the extreme pain.
Do you have a computer?
Yes.
So go on our website, net.net/askthedoctor. You'll see that, and you're going to see his name there. He was on the first show of this season.
Okay, let me write that down.
Okay, I got to run now. Stevens, Stephen's. Thank you. Now we're going to go to Ann, who's waiting patiently. Hi, Ann.
Hi, doctors.
How are you doing?
I'm doing good, thank you.
Where are you calling us from?
Manhattan.
Oh, we always like Manhattan calls. Which part?
Upper West Side.
Very nice. How far up?
86.
86, yeah. Right. Beautiful area, isn't it, to walk along the water there?
Oh, it's fabulous.
And the restaurants are amazing there.
Oh, everywhere. It's the best.
Yeah.
Yeah.
What's your favorite?
Well, my favorite, there's so many, but I would say Mirabella's.
Mirabella?
Yeah,
Where's that?
It's on 86 in Columbus.
Well, very nice. Italian?
It's French. It's just fabulous.
French. We're going to enjoy that. Thanks a lot for the tip.
Okay.
What about Nice Matin? You ever go there?
No, where's that?
Another French place that's on 83rd, I think, and Columbus.
Oh, really?
Yeah, Nice Matin, N-I-C-E, M-A-T-I.
Oh, yeah. No, that's 79th. I know where that is.
Yeah, it was my accent, I think, that threw it off.
Yeah, I know that one. Yeah, I've been there.
What can we do for you tonight?
Okay, my question deals for you and the dentist.
Yes, here he is.
Okay, it's about dental implants and the need for CAT scans. I've had dental implants twice. Both times the periodontist required CAT scans. Now I'm about to have a third, and he's thinking I may need another. And I heard you say nobody really needs more than 5 CAT scans in their life. And
right,
why do I need a CAT scan?
Let's talk to Dr. Balba. Why does she need so many CAT scans?
Well, some dentists feel that because of the proximity of certain nerves, that you should know exactly where the nerve is so that you don't impinge on it when you put in the implant. But you should have had more than one is really a lot to ask.
Yeah, Well, couldn't he use the ones that he's already I've already had done?
Since I don't know your particular case, I can't tell you. But most dentists prefer to use CAT scans before they do any work on you.
Is this something you could help her with, Dr. Balber?
Well, yes. I mean, she could come in and I could give her, advice. But
no more CAT scans.
No more CAT scans.
No more CAT scans.
For sure.
No more CAT scans, please.
And for $1,750, you have an implant and a tooth in your mouth.
Yeah.
And you walk out with a smile.
Yeah.
That's right.
Okay?
Okay.
So why don't we do that? But hold off on the CAT scans until at least you get another opinion.
Okay.
It's too many. Hope to call us back soon.
All right. Thank you.
The last caller tonight is Lynn. Hi, Lynn.
Hi.
Lynn, where are you calling us from?
Williamsburg.
Williamsburg. Can you make it a little louder? Thank you.
Williamsburg. Can you hear me better now?
Yeah, beautiful, beautiful. What can we do for you tonight?
I'm having like really bad migraines. I've suffered with them since I was a teenager.
Migraines. Tough issue with a 30-second answer from Dr.
Migraines now, there's great drugs to treat migraines that work very effectively, and they actually treat the root of the problem. There's drugs that actually relax the blood vessels that are responsible for causing the migraine. A migraine, of course, is a vascular headache, which can be very severe, last for days, usually on one half of your face. So there's drugs. The first one in its class was Imitrex, but there's other drugs now called Zomig and Maxol. Some of them are sublingual, some of them you spray in your nose, some of them are tablets. But they work really well, and then you can go back to work. The key is treating it early in your headache. Once the headache is rolling for a day or two, you need much more medicine to knock it down.
Thank you.
That's been the problem because I do take Maxol and I've been taking
Lynn, I'm getting angry messages from our floor manager because our
then
time
there's
is
other
up.
drugs like beta blockers and calcium channels you could take on a regular basis to prevent it, in addition to
Lynn,
those
please
drugs.
call us back next week. Thank you so much. Now we're gonna. Before we call, I have to say hello to Joe Stiles, who's one of our most loyal listeners. Also a gentleman who's aged beautifully and is a tremendous asset to the city, to Brooklyn. I know he's on the board of trustees at Community Hospital. So it's really a pleasure to say hello to him. I hope you get through next week, Joe. And I can't believe where the time went. I don't know what happened here, but that's it for this edition of Ask the Doctor. I'd like to thank Dr. J. Herbert Balba. 3 names are very classy. I like that. And Dr. Placido Morano, of course, and Dr. Emil Backish, who's president of the medical staff at New York Methodist Hospital. I want to get into that on a future show. Sure. And we hope we're able to help you. It's good to remember that you should be proactive about your own health. Speak to your doctors about your concerns. And as we said tonight, go for second or even third opinions. Don't just accept that this is the only way to do it. In the meantime, continue to watch the net and visit our website at netny.net/askthedoctor. Here you can check out our past quizzes, submit your thoughts on the forum, or watch past episodes. I want to thank you for all your calls, and I'll see you again next week. And if you haven't had enough of this show, you'll see a repeat of last week's show at 10 o'clock if you want to watch on the same channel. So goodbye, stay healthy, and I'll see you in the tablet.